question for the economy. How does trade with China affect America and Iowa moving forward? Representative Loebsack?
That's a wonderful question in a variety of ways, as you might imagine. Look, there's no doubt that China is an important trading partner. China is an important player in the world community, economically, from a national security standpoint, from a variety of standpoints. But when they joined the World Trade Organization, I think they understood that there are certain rules and regulations that go along with being a part of the WTO. And one of the big issues I think that's out there, which is quite fascinating, that I'm not sure where John stands on this, but in the Congress, when it comes to the China currency issue, there's a lot of bipartisan concern about the Chinese essentially manipulating their currency. It's been going on for quite some time. The Senate has passed legislation that already tries to take care of that. The House, that's not been the case. I've been very involved in this legislation. I think we've got to hold China accountable. I think we have to make sure, going forward, that they understand that they're going to be good partners in the world community, in the world economy, that they've got to play by the rules that they agreed to. And when they devalue their currency, when they artificially devalue their currency, those of you out there who know how this works in the international trading system, what that means is that the goods that they sell to the United States are artificially cheaper than they should be. So I think we've got to take steps to hold them accountable. But I think we've got to go beyond that. As a member of Congress, I'm a member of the Steel Caucus. I'm a member of a number of other caucuses. These are groups of members of the House of Representatives who get together to think about these issues, to think about ways how we're going to move forward on these issues. And I hear from folks all the time, it's not just the Chinese, it's a number of other countries that are dumping their goods on the world market, that are engaging in a number of different types of unfair trade practices. I think, and I hear this all the time when I'm back every weekend in the district, when I'm talking to folks, you know, from Lamoni to Clinton, people want us to make things in America again, and we've got to make sure that we enforce the rules and regulations with our trading partners so that we can make things in America again. Thank you.
Mr. Archer, same question. How does trade with China affect America and Iowa moving forward?
Well, trade with China obviously is very critical for the U.S. because we do compete in a global economy. And this is one area where my opponent and I have stark contrasts. My opponent voted against 3 free trade agreements with Colombia, South Korea, and Panama. And former Governor Loebsack and current Ag Secretary Tom Loebsack indicated that those free trade agreements would create tens of thousands of jobs here in America and thousands of jobs here in Iowa. And Congressman Loebsack voted against those trade agreements. He voted against jobs. You know, just recently, the most recent attack ad that Congressman Loebsack has put out has attacked not only me, but one of the major employers here in Iowa, John Deere. You just don't do that here in Iowa. You don't attack one of the largest employers in the state of Iowa. You know, just recently, the Des Moines Register has ranked Congressman Loebsack the most ineffective member of the Iowa delegation. And when he couples that by attacking John Deere, he's simply out of touch. We compete in a global environment, and by entering into those free trade agreements, you know, we are entering into new markets, or we're opening up new markets for John Deere, for Case New Holland, for Siemens down in Fort Madison, to export those products, those services, to the rest of the world. Thank you.
The next topic will be healthcare. Given the complexities of the federal and state healthcare laws, what are some of the key issues and measures you support in the area, and which measures are you against?
First, I do want to take this second to respond to what John just said. I made it very clear publicly that I have absolutely no beef with John Deere. John Deere is a great company. I'm a native Iowan. I grew up here. I know how important John Deere is to the Iowa economy. I visited the John Deere plant in Ottumwa 3 times, celebrated their 100th birthday on one of those occasions. My beef is with my opponent and with our differences that he has outlined on trade policy. I can guarantee you that I'm never going to vote for a NAFTA-style so-called free trade agreement that's going to cost jobs as NAFTA costs 11,000 jobs in Iowa. When it comes to health care, I voted for the Health Care Act because I think it's really important that we do everything we can to get as many people in America insured as possible. If we repeal the health care bill that my opponent has in fact endorsed, what that means is that suddenly there are going to be thousands of Iowans who are 24, 25 years old, who have the health insurance now that they have with their parents that will be taken away from them. I'm not going to vote for that. It also means that seniors who now have been saving $600 to $700 a year because the donor hole is closed by 50% on the Medicare Part D prescription drug plan will suddenly have that donor hole completely open. It's going to cost them money. It means that the women in this audience, it's no longer legal to be for just being a woman to be considered a precondition. If my opponent had his way, and if he repealed the health care law, women, just being a woman, would be considered a pre-existing condition. Also, children who now can be covered legally, they cannot be refused coverage for pre-existing conditions, suddenly they would be thrown off a health insurance plan if we repealed the health care law. Beyond that, we're working towards making sure that every American is covered under this health care law. This is a good goal. It's a goal that I'm proud of. I'm working as hard as I possibly can on that front, and on the Medicare front, and on health care in general, to make sure that folks have access to affordable, quality health care, and that's the bottom line.
Thank you. Mr. Archer, the same question. Given the complexities of federal and state healthcare laws, what are some of the key issues you support, and what measures do you oppose?
I just want to make it crystal clear and ask my opponent what company he was referring to in that attack ad. Also, the UAW was in favor of these free trade agreements, and keep in mind that President Obama signed these free trade agreements. Again, these free trade agreements would create thousands and have created thousands of jobs all across America. And we need to stop the scare tactics with respect to calling out specific segments of the population, women or children, with respect to repealing Obamacare. Anytime we talk about health care, I think we have to talk about costs, the costs of health care. And why are the costs of health care so high? We had an opportunity several months ago to visit a hospital in Burlington, Iowa. And sitting down with the CEO, he said, John, 30% of the procedures that we conduct in the emergency department are because of the litigious society that we live in. That's 30% additional costs. Just recently, the state of Iowa, through a competitive bidding process, saved over $20 million by having a competitive bidding process. So we must open up competitive bidding for health care. Wouldn't it be nice to allow an individual in the state of Iowa to purchase an insurance policy from a company in California? Competition proves to work. And just recently, my 3-year-old daughter had a cold. And before we took her to the emergency department, or before we took her to her primary care physician, we had to reach in our own back pocket because we have a high deductible health savings account. And that drives the right behavior. We went to Walgreens. My wife is in the audience tonight. We went to Walgreens and we bought some cough syrup. And Beatrice is doing much, much better. So we have to discuss costs and get costs under control anytime we talk about health care.
Thank you.